Hey, everybody. How are you? And I think I have a lag. Hmm. What is going on? Okay. Can y'all hear me okay? Because I think my camera has a lag. Hey, how are you? I'm trying to. Yeah, I have a lag, y'all. I'm going to have to probably back out and come right back in if you can hear me. Hey, Brian. Kathy Ann, I don't know what's going on, but I'm going to back out and I'll be right back. Okay. Okay, y'all can hear me? Okay. I don't know what's going on with this. It's got a lag, but maybe it'll catch up. Hey, Journey. Hey, Brian. Hey, Marie. Aria, thank you for being here. Let me see who I got in here. Kathy, and thank you. I'm sorry I was dealing with some in real life issues. Tonight is a super full moon and lunar eclipse, so it's going to be wonderful. Let's see who else. Journey. I got in Journey. I got your live. I was right at the end. I was saying, I'm here, and you were logging off. So let's see. And have I missed anybody? Violet, hi, welcome. Hey, Sophia. So, how is everybody today? Um, I will tell y'all that what a beautiful full moon said no one in healthcare ever. Yeah, I jumped on Journey I mean, like, I couldn't even get it typed in fast enough. So, yeah, it's been a long day. It's been a long day for me. That is what is going on. Hey, Mid Sunrise Dawn, thank you. I couldn't even get this set, but I guess it will be what it will be, right? That's what I wanted. It's got a lag for some reason. Not sure. Oh my gosh. Hang on, y'all. What is going on here? Full moon. Well, it's been having a lag and then it just went off. So let's start this again. Thank you, Miss Sunrise Dawn. Oh, come on. Yeah, leave it right there. And my light did not come on like it was supposed to. Oh. So, Aria, you and me both. It has been, well, no, I'll say that tomorrow. So we'll see. Something is wrong with this camera. Yes. 1 second, guys. Don't know what's going on. Okay. I think it's a little lag. Nope, it's still got a lag, but oh well. Hopefully it fixes itself. So I wanted to do a Q&A, y'all. We've been covering quite a bit, and I'm not going to be able to do this. This lag. Kathy, what do I do? This is weird. Oh, thank you, Journey. No, this is weird. It's like I'm talking and then I'm seeing myself talk. I don't know what to do. I kind of feel helpless back here by myself. Um, so I want to do a Q&A and maybe, I don't know, if you want to come on and talk. I'm only going to be on here though until I want to try to stop about 8:15, 8:30 if possible, because I do want to go outside. I'm going to be on my TikTok live. It'll be my first time to go live on TikTok. Yeah, paying no attention to the person on the screen because the person on the screen is getting on my nerves. My TikTok live, it'll be the first time I'm going live on there. Um, I've had the ability for a few weeks. Well, when I talk, like it's I'm moving my hand. It's moving way after that. So I don't know what's going on. But I've had the ability to go live on TikTok for a few weeks, and fear has stopped me. It's a dive that I needed to go into with my therapist, and we did. And she thinks it's Mandy. You want to come up, Mandy? Um, I think. Okay, all right. Here, Alicia, let me put it in here. Let's see. Yeah, it's weird on my end. It's kind of weird. Okay, Mandy, that's fine. So yes, it's a full moon week. Yes, I work in mental health. Yes, it's been one. um, Surprisingly, it's not been as bad as it could be. So, okay, let me tell Rachel that. Hey, Rach, I'm on a live. I didn't say it. I didn't say I want to laugh. Am on a live. Okay. Says, hey, Rachel, I want to laugh. I guess it's telling me something. Kathy, my savior. Something is wrong, Kathy. I'm lagging back here, and I went out and come back in, and I don't know what to do. And it's really bothering me because I move my hand and it's got a lag. I talk and watching myself on the screen. I don't like this. And I don't know what to do about it. So, um, you're trying to be a human. Mandy, you are a human. Mandy, you are a lovely human. I guess it's StreamYard. Okay, so we'll go with it. Uh, there's been a lot. We've had a lot of discussions. There's been Journey. I know that her story. Yeah, Journey, I love you. You are my friend, and you know I am here anytime and whatever you're going through. Oh, was it okay? All right, thank you, Kathy. But I'm going to tell you, absolutely, Mandy. I think with this full moon, super moon, lunar eclipse in just a little bit, I think that would be great. But I wanted to do a Q&A. So let's just, I mean, honestly, there's been a lot going on. I've dealt with this fear, and I think where this fear is coming from um, is, oh, there's definitely, I promise you, work in the ER, work in the ICU, absolutely. And in mental health, most of all, in labor and delivery. Yeah, Journey, I love you. Um, one thing that made me smile today, and I should not have to think about this, right? I mean, this should not even be something I had to think about, but let's see. Hmm. Looking forward to this live, but actually, what made me smile today was waking up thinking that this is going to be a good day because I get to film another lunar eclipse. That's actually the truth. That's I was smiling about that and my family. Let me get her up on stage. Okay, Dawn, can you hear me?
I hear you.
All right, okay. Do you see a
You're,
lag now that you're
um, sorry,
like?
no,
See, I wave. It's way off.
that's weird.
I know.
It looks
Kathy
okay
said
from
she was
my
having
end.
trouble with screen. Hey, Tammy. All right,
I
so
wonder
let
if
me
it's
fix
because
this
I'm
again.
on my phone. I wonder if it's because I'm
It
on my
might be.
phone
Yeah,
instead of my
there's.
laptop.
I don't know what is going on here. Okay. What
All right,
is?
there we go.
I'm not trying to do this. It's not my camera. The last time I did this just a while ago, it quit on me. Um. So yes, that made me smile. Was knowing that there was a lunar eclipse. I love as much as I don't like the effects of what the full moon does to people in my profession. I do love everything about the sky, the stars, The moon, the sun, the planets. I mean, meteor showers. Oh, yeah, it's good. I think it's backstage on StreamYard, y'all. It's okay. I'll deal with it.
I
So,
can't.
um, so what have you had
What
going
can?
on, Miss Sunrise Dawn?
It's been a day already. They did my dad's biopsy today, and the doctors. He's got to wait for the results to officially come back. But the doctor said he thinks that it's malignant, which will be
Oh
my dad's.
no.
Yeah, it'll be my dad's third round with cancer. So
Third time's a charm. Make it go away.
yeah,
Make it
but
go
yeah,
away.
he's beat it the first two times, but it's kind of left him not. I wouldn't say weak. I would never say weak with my dad in the same sentence, but kind of took a little wind out of his sails, I guess.
Oh, I'm sure. I mean, it's a hard road to go down anyway, right? I mean,
Right. But now I can't say it has by much. That ain't much slows that man down for long. Like he got done with this procedure this morning and went to a church board meeting tonight, even though he wasn't really supposed to go anywhere. Anyway,
there you
but
go.
at least my daughter made the night easier. She put herself to bed.
Really?
She just she's
Oh,
never done
wow.
that before. She's never done that before. She just walked by me and said, "Night night, mommy, I love you."
Uh-oh.
Okay.
We're growing up.
Yeah, no, I don't like it.
I know. Yes, Aria and everybody. You see the chat, right?
No.
No, you can't. Oh, okay. Let me put this up
Uh,
because we have
yeah, I
lots of
can.
people. Let's see. There's Brian. He said, "Ouch, that's no good. Sending good vibes, Miss Sunrise Dawn." Marie, um, fragile, and she put the
Yeah.
ones. And then Aria said, "Oh no, sending prayers and good thoughts."
Thanks, y'all.
So
It's either
yes,
I
we
can either
are.
see. Sorry, I was gonna say I can either see you or see the chat.
Oh, okay. Well, if I see one, if I can see through this blinding light. Um, so what has Sophia? Yeah, absolutely. Yeah.
I'm,
Oh
trying
wait,
to kind of
here we go. Here we go, Marie. Fragile to describe your dad, Dawn.
fragile. Yeah, maybe a little bit. I mean, I don't know. I guess you'd have to. No, he. I mean, he's one of those people. I don't know when the man ever slept. Like he was constantly going, constantly.
Yeah.
But he's finally slow. It's slowed him down just a hair to where he's more like at normal human speed instead of his usual superhuman speed.
Yeah.
But he's
Well,
I've been trying to hold it together so that my daughter doesn't get upset. And I noticed when he was talking to her, Dad was acting like he was just acting like everything was perfectly normal. But
okay. So how? Let me ask you this: How did he do with the last two times? Like,
he passed them like,
attitude, or maybe attitude's not the right word I'm looking for. With his
uh,
outlook on it.
oh, I mean, he never had a bad outlook on it. Like he was always just, okay, let's just get this done and over with. I'm getting ready to get through this. Let's get to the next part. Let's get to the next part. I don't think he was
Okay.
ever like depressed or down or anything like that. But you know, my my sister and I, we joke about it, but it's the truth. If we want to know how my dad's doing, we ask my mom. If we want to know how mom's doing, we ask dad. Because
Absolutely. Hmm.
mom asked us
Same, same, same.
when he was going through chemo, we were, I think, I don't know where he had gone
Oh
somewhere.
my
He was, sorry.
Oh, that was from Kathy. I just wanted to pop that up there.
Okay,
Could
I
you
don't
see
even have
it?
my reading glasses. I
Oh,
don't have
yeah,
my
okay, it
reading
says,
glasses
"My
with me.
dad was the same way when he had cancer. There was more than once they cracked his ribs to take it out of his lung, and we to take the cancer out of his lung, and we had to tell him, no, he couldn't go to work 3 days after being home."
See, that's the thing with my dad. I mean, he's retired, but he likes to do a lot. He does a lot of stuff around the church. Like he does the payroll, he does maintenance. There's a daycare attached. He does stuff for the daycare. He does pay. I mean, he does payroll for the daycare too. He does it all. And he went to a church board meeting tonight. He wasn't
Well,
supposed to go anywhere.
he's got it. He's going to do it his way. You know them.
Yes, but he's
I know you're the daughter.
yeah. Well, and the
Aria
thing with
says cancer is hard. My stepdad has been fighting for a couple of years now. I'm sorry, Aria. Whoa,
I'm
whoa,
so
whoa! This
sorry.
chat's
It's
moving for
awful.
sure. Hi, Amina. How are you, sweetheart?
Hey, Amina.
Um, let's
Well,
see.
go ahead. The thing
Let's
is,
see.
I mean, like my sister and I don't remember where Dad was. He had gone somewhere, stepped outside or something. Anyway, we were sitting there, both of us talking to my mom. She said, "Why don't either of you ever call your dad and ask him how he's doing?" I said, I said, I do call Dad and ask, then I call you. I said, because every time when we ask Dad how he's doing, and my sister and I both at the same time went, "I'm okay." That's exactly what he says every time. Mom just laughs. She goes, "Well, you got a
Oh,
point."
Amina said, "We love you, Miss Sunrise, Donna and Keilah. Love you too, Amina.
Oh, I love you too,
Very much
Amina.
so."
Thank you
Yeah.
for messaging with me a little bit earlier. I know we
I
didn't
know.
message
Isn't
a
she
lot, but
a great person? She's just a great
she
human
is.
being.
I agree.
Um,
She actually messaged me earlier to ask how everything was going with Dad.
well, how are you doing with it? That's the big
I'm
question.
trying
Hey, Hope Between the Dreams.
I'm trying to not I'm trying to hold it together. I don't want my daughter seeing me upset. I don't want
Okay.
and then I figure falling apart's not gonna help. It might help for a minute, but
We're all allowed to fall apart. We just have to pick ourselves right back up.
yeah.
We can't let it
I
just
don't
stay. You can't just let it stay in there and eat you. Sometimes you just got to go to the bathroom, shut the door if that's what it takes, and let it out.
I don't think it'll fully get me until they come back with the test results and say this is official. But my mom and I both, and yeah, and I didn't really ask my sister, but my mom and I both were like, yeah, we don't have a good feeling about that. And I'm sure my sister feels the same way.
Sophia just said, "Tell the stubborn mule if he wants to keep kicking, he needs to slow down. He's got a great grandbaby to watch grow up after all."
Exactly. He's Dad's never been one to really show his feelings a whole lot, which I never really realized that until we were grown. He just doesn't show his emotions a whole lot, but I think he's excited about this great grandbaby. He won't say it,
And
but I
now to
think
give
he
him
is.
something to look forward to.
He does. And plus, with my daughter being 5, he
Hmm.
really loves this age right here with the kids. Like he'll
Yeah.
call sometimes in the mornings and just he don't even say hi to me. Just can I speak to you know
That's a sweetheart, though.
it is.
I know we've got our grandbaby back. They live behind us, and I'm like, I was like, I gotta go see him. I want to just go see him. I just want to go see him. And I got to see him yesterday. She came out. She pulled up in the yard in the car, and they got that. It's so cute. They have the camera like facing his because he's backwards in the back seat, and the video screen right up front, so she can see him at all times. And oh my
I
gosh,
need that.
he's just he had his little animal. He was just gooing and all, and it was just like he's only let's see, he was born June 28th, so 2 months, and he's already at his 3 to 6 months close.
Oh wow.
He was big. He was big when he was born,
Uh,
but yes.
My daughter is she's very big for her age. She's 5. I'm 6 foot tall and she comes up to the middle of my chest. I don't know exactly how tall
Wow.
she is. She's the tallest one in her class and she weighs 72 pounds at 5. She's a big girl. Now my oldest, I mean, she was the exact opposite. She was always the smallest one in the class. She was
Oh.
always tiny. Even now she's pregnant and barely showing.
Hey, my sister was the one underneath me. She when she had my first niece, my ever, She was 9 months pregnant. Actually, she was a confirmed 10-month pregnancy. Like she had a dry birth. She
Yeah.
had no fluid left in her. I was like, oh my God. It was the worst thing ever. And
Wow.
they didn't, she had her natural. And
Ow.
but she was wearing a size 5 buttoned up. And she was 10 weeks, I mean 10 months pregnant. I was like, huh?
My daughter has like if you know her really well like I do, you can kind of see the bump. But if you didn't know this child, you'd swear she's just like stick, you know. And she's due at the end of November.
Oh, it's close.
Yeah.
Yep. I
My
know.
mom's like, I'm,
Go
I'm
ahead.
sorry, I was just gonna say my mom's like, I'm just worried the baby's not growing. She's not very big. I said, well,
The
that don't
baby's
mean the
gonna get what
baby.
the baby needs.
I said, that don't mean the baby's not growing. That means that, well, we worry
Yeah.
about her because she's always had issues with her stomach. And she
Yeah.
told me, she's like, she's told me before, she said, Mama, smoking, I'm not gonna say it here, but she said smoking is the only way I get my appetite.
I
But
bet not, Aria. Poor baby. You can't
that's,
hide that.
yeah. I mean, my daughter's telling me, she's like, Mama, she said, well, the only way I can get an appetite is to smoke, not cigarettes.
Mhm.
And I don't know
Yeah,
about
to
everywhere
make
else, but here they test the babies
they test the
when they're born.
placentas too.
Yeah, it's just she's got to stop doing that. And
Yeah, because 'cause
she's
they'll
like, I
test
don't know how I'm
yeah.
gonna eat.
Well, also
Mm.
I know a bunch of people that, like, that have been pregnant, that's the only thing that stopped their nausea.
Yeah,
But, yeah, they check the placenta on that for sure, I know. Mhm.
yeah. She's
So,
like that. She's like, so she can't. She's already stopping doing that. She's like, I don't know how I'm gonna eat. Like, well, you got to make yourself.
yeah. So does anybody in the comments have a question? Mental health, otherwise, anything going on? I just wanted to come on here and just have a chat because Journey has actually um Journey has actually got me on a down a deep dive now. just just from what all she's doing. She's made me want to help even more, you know? And
Yeah. And I saw,
it's just
I just kind of peeked in the chat for a second. I saw somebody had said something about, I think it was Marie said something about there's medicines for nausea.
Zofran, don't
She's,
overdose on it.
yeah, and she's always, I don't
Oh,
know,
hope
she's
between the
always,
dreams. Thank you.
I mean, she'll take sometimes she'll take the medicine. It might work temporarily, but it doesn't.
Zofran, no, it don't help, especially when you have food poisoning. Don't take too much of it because it has the opposite effect. Okay, so hang on.
Yeah.
I want to know. Okay, Aria, so the secret's out. I can say something. I have not said a word. I have kept the secret, but obviously it is out now, correct? I want to make sure I get a yes. I have kept my secrets. Tammy, where is Aria?
Hey, Tammy.
Obviously, obviously it's out. Hey, Tammy. Obviously it's out because she wrote it. But I want to double check.
Hmm.
And when I get her to say yes. Oh yeah, she did announce it on Facebook. Okay, well good. Then I get to tell the secret on this channel. Aria, you know she just had lyric not long ago,
Yeah.
and she is pregnant with twins.
Wow.
Yes,
Congratulations.
and now that and she's 14 weeks.
Wow.
So I'm so happy, Aria. I have not announced it. I have kept my mouth shut. It has been the hardest secret ever because I wanted to tell her congratulations so bad.
Well, I, when I had to wait to announce it on Facebook, but I came on here like that day when my daughter told me. I was like, I couldn't be grandma because none of y'all know her. But now on Facebook, I think I only had to wait till like the next day. I couldn't have kept my mouth shut any longer because I told her, it's like, are you telling people on Facebook or something? 'Cause I said, you know, I cannot keep my mouth shut. She just laughed at me.
Yeah, look, Ari said, "Thanks, y'all." We were definitely shocked. Okay, wait.
Is it is it
Let me see.
identical twins or
Let me put this.
fraternal?
They're fraternal. Yeah, I already asked. I didn't dug. I didn't dug all the way into Ari's pregnancy. I'm just a friend that just keeps digging. Details is often given during pregnancy. I was a mom, baby, high-risk pregnancy nurse for many years. Hyperemesis. Yes, absolutely it does. No, I agree with you, Marie. I do. I do absolutely agree with that. Now over here, I mean, like it's just like they give you Zofran and then it doesn't work like some for some people. Yeah, Aria said
Yeah.
I got interrogated by Keilah. She did. It was a lot of love. I just was like so excited.
I had my daughter got interrogated by the rest of the family, so I didn't ask much because I was like there were throwing
Oh, on
questions
the
at her left and
14th.
right.
Wait. Oh, the next coming 14th, you find out the genders, but they are fraternal. Yeah. Right now they're fraternal.
Awesome. I always
Yeah,
thought I'd
that's an
want to have.
expensive drug. They won't hardly approve it. It's very expensive. So that's why they go to Zofran and it don't. They used to do the Nubain for nausea and pain, and then I think that just went out the window also. When I worked in labor and delivery,
I
and
had
I'm like, y'all are
Nubain.
really giving a woman pushing a kid out Nubain, and y'all think that's really going to help her? Okay.
I had Nubain when I was in labor with my oldest. The clock was melting off the wall.
I guess I get it. Promethazine knocks me out, but that's what they have to give me in my IV when I had surgery, and they had to give me pain medicine that I'm allergic to. So I have to take Benadryl and promethazine and epinephrine, everything they could put in there just to get the pain medicine, not to kill me, but I needed it.
But
Tammy, what's going on
I,
here? Let's see. I'm going through some rough times, but I have been through it since our 32-year-old son has been addicted to drugs and alcohol since he was young because he was given a narcotic after an accident. Do you know that's the way it always starts? A knee injury, a
yeah,
sports injury. Tammy, I'm
yeah,
sorry.
that's Tammy. That's one of my mods on my channel.
Is it? Okay, I'm
Yeah,
sorry because it's horrible. That's the way it always starts. I don't even know
yeah.
what to say because it's a fight I've been fighting and advocating against for so long.
My husband worries. Yeah, my husband is on. He went to pain management. He doesn't go there regularly, but he kind of goes there like once or twice a year, I guess. He has to go to pain management, but they've got him on um they've got him on a pretty high dosage of, I think it's oxycodone, and he's so worried that he's going to get addicted to it. And I'm like, if you need it,
Okay, if you need it, take it. I agree with
then
that.
you need it. Yeah, but I mean, I think he's supposed to take like one or two a day or something like that. He don't even take that.
And see, the thing
Um,
is, oh wait, what did Tammy say? Now he is dying from liver failure and on the streets by his choice. Okay, so Tammy, I'm going to tell you this. This is my I have to disclaimer. This is no treatment. This is no advice about treatment. This is strictly my opinion and only my opinion. Do not stop seeking the help from your doctor. Oh, and I needed to put this banner up. I forgot. Oh, my bad. Okay, that was my fault. Okay. So here it is. I'm going to tell you, Tammy, by choice is something that working in the mental health field and especially with dual diagnosis, it's really, really difficult for the family. The only thing I can say is there's nothing you can do to change that until he's ready to change. Okay. There's nothing. Now you have a therapist. So shut up, Kiva. But Tammy, I'm not sure what state you're in or where you're in. So I don't know the laws, but I mean, there's some places that because of his, his health, um, there are places that make it help. I don't know your situation, but I'm just, our prayers going up for you and in him, and I hope that things work out. I really do. It's a hard thing to
Me
deal
too.
with.
Yeah, I'm a recovering addict myself. So yeah, you can say from experience. Yeah, if they don't want help, then you can't force them. And it's frustrating. I know it's frustrating. I've been on both sides. You know.
You know, it's really frustrating. The reason that my patients that I have at my facility, it's so frustrating because the family will come and say, like, "Well, get how did y'all get that?" You know, how do you get them to act like that? They won't act like that with us. No, they're not going to because they don't know what our boundaries are. They don't know hey, Kathy, they don't know what it's different. Like, my
Yes.
residents, even in their worst mental health, let's just say off their baseline really bad, okay? They're not going to push us the way they do families, their family member. And that's why they
Hmm.
can't stay with their families. And that's why they are with us because the families are like, well, we can't get them to take their medications. We can't get them to do this. We can't get them to do that. No, you can't. But that is what we're here for, is for the family and the person. And
Right.
while they are in our I mean, and usually, people that come to my facility end up they're mostly there forever. I mean, until because we don't have a big turnover because they're spoiled rotten. I'm just gonna tell you honestly. They're spoiled rotten. They don't We do everything for them. But, oh, no, Tammy. Yeah. See, that I've had some that's come in and then the families are like, "We can't even get them to take their medicine." No, see, but it's like this, and I will tell the patient, "You have the right to refuse your medication, but you do not have the right to refuse your medication and remain here, and this is your last option." So,
Right.
I don't take away their choice, but I do not veer from the rules, and they have to be medicated to stay there. So, and boundaries is really hard for some, especially with mental illness, for some families to keep them boundaries because they just see their loved one, or they go total opposite. I don't ever want to speak to them again. And then, they'll be on their deathbed or something. And, I'm like, do you want to come see, your mom, your dad? Well, no. I'm like, oh, okay. Well, I understand that things have went on in the past. We have no idea about. I can only imagine what you've been through your whole, dealing with this your whole life, but they're at the end of theirs. And I think it would do
Right.
yourself good to come and visit. So, I
Right.
mean, that's worked a lot, and I always get a thank you after that because they're like, "You're right, it was helpful." I mean, even if it's
Yeah.
not for the person leaving, it's for themselves to
Exactly.
not
To
to
get
not
that
have to live with regret.
right. To get that closure.
Yeah, exactly.
Yep.
We dealt with times where dad didn't see the need to get the help he needed, and we had to figure it out. The reason two of the home care nurses get a nice thank you. Oh, Sophia, yeah. But so, yes, I mean, like, we are all going through struggles. Boundaries are a big one. I mean, they are.
Yeah.
Um, Boundaries are
Yep.
big because I can tell you this. Once you start enforcing them, you're not the nice person anymore.
No.
So, and that goes like I started at work, so I had to start somewhere. So I started at work. And when I came back after the snake surgery, when I go, I'm not there all the time. Yes, exactly, Journey. Exactly. Um, I started putting the boundaries down, and now, granted, I've been in therapy this whole time, you know, and they don't like it.
No,
They don't.
I don't.
They want to still see me as who I was. Hey, Dawn Gloves, welcome in.
Hey,
Um,
Dawn.
they want to see me as the person that they could run over, like always, honestly. And I allowed them. I showed them how to treat me. I
Yeah.
showed them how they're allowed to treat me, and I couldn't do that anymore because I would just sit there and take it. So now, whenever I say
Yeah.
something, I'm always, and my employees know, please and thank you after everything. I don't care what it is. I mean, I
Yep.
could be giving somebody a good hollering and, I'm gonna still end it with please and thank you. And, that
Right.
is something that is something that is practiced. Well, um, my eyes are burning. So oh god. Yeah.
Yeah, I
So
was a
now I tell
doormat. Yeah.
I don't know
Go
what
ahead.
in the world's going on. I said, "So, here's the way it goes. I said it, do it. There's no more.
Yep.
Not from me. There's no more arguing. There's no more questioning. It's simply, I'm the boss, and y'all do not know how much I despise that. I do not want to be that person, but you have to be.
Hmm.
And so I tell them, I'm the boss. I said it, do it. Don't question me why, when, how. Do it. And I do not
Right.
follow that up with a please and thank you anymore because it's not a request. So that's a boundary that
Exactly.
I've put up. It's very difficult to enforce it, but it became easier and easier and easier. The first few write-ups I had to do, I'm not the disciplinary one, I just I don't know. But I did it, and it got a little bit easier and easier, and now they know that I'm not joking around anymore, and I those boundaries are set. Now, I have a boundary here at home. We had to start out small. This door, if it's closed, do not open it unless it's
Yep.
an emergency or I've got you doing something, ask them to do something. They know, do not open it because that's just a boundary. This is my space. And once I said it the first time, they have respected that. So I'm doing better on that. It's harder at home than it is at work. But once I
Yeah.
got into that, setting the boundaries, especially when people would come to me and like, "Oh, have you heard?" No, I haven't and don't want to. Don't have the emotional capacity to take on anybody else's issues. I have enough going on. That's my emotional
Right.
boundaries. So,
Yep. Hey,
so
I have. Yep.
that's an issue I'm dealing with. Oh,
I've been the same way.
anybody is it?
It's been the same way here. For years and years, I was a doormat.
Mhm.
Pretty much anybody could walk on me, and
M
I
me
noticed, especially after I went through my divorce, it's like I was done with that. I don't. I'm done being walked on, and yeah, now I've got people that I've been called names, told that I'm mean and everything else, just because I don't let people walk on me anymore.
exactly. Because you
But
know what, Dawn? Imma tell you this. Once you put those boundaries up, th the true people I don't know how to say this. First of all, the people at home are gonna find it the hardest because they're not used to that. So,
right.
yeah, you're gonna be mean. Um, so, Marie, I'll get hang on one moment. And then, but the ones at work, there's not an option. I mean, if I'm gonna take all the responsibility and have got their lives in my hands, literally, my staff are gonna do what I ask them to do or tell them to do because we're not playing that game anymore. Just do what you want.
Right.
And, yeah, it's not gonna happen because they're not the ones who have to they just go in and they work their 8-hour shift, and it is a hard shift, I'm not gonna lie, working with people with mental illness, working with hospice patients, and making sure, their meds are done and everything, but here's the thing, I am responsible for not only the employees, the residents, the medications, and everything else that comes with running the place. I'm responsible to state agencies, to anyone else, that come in and I'm gonna have it the way that I have it set, following company policy and procedure and patient safety.
Yep.
And and so there's no arguing with me anymore. So I can be the mean one, I can be the bitch boss. You know what? I'll take it. Call me, hey, call me Miss Bitch. I don't care. I had a patient, a hospice patient that did that. And I would give anything to have her back. Hear that one more time. And it's so that's getting me so hard because she passed away on a lunar eclipse.
Oh,
Like, I
sad.
know,
I'm
and it's a
sorry.
not so lunar eclipse. I thought about it this morning. Yeah,
You know, my
I thought
best
about
friend had My best friend had to she was a CNA, I
Hey.
think,
Mhm.
and she had to quit working at the nursing home because there was so many, several residents that, after several of them had passed that she got really close to. She told me, she said, I don't think I can do this anymore. And I can't blame her.
So I have okay. Wait, I wanted to get back up to Marie before I lose this because I didn't start anything because I'm trying to read all the comments. I don't have anybody backstage. Hang on. Okay, so
Sorry,
what Marie
I
said.
knew how to start
Keilah,
stuff. I would help you.
are you able to take time off from work and not be on call so that you can really look after yourself? I've actually been off work, Marie, for honestly, let's see, 9 months was September 8th. Was 9 months since my surgery, and they told me it was going to be a 9 month recovery. They actually just, thank you, Kathy. They just took me off. I just did my last physical therapy appointment. So after, the 9 months was the recovery period. Um, obviously it worked. I mean, I couldn't used to do this and this. Oh, well, that was a little tight, but now I can. I can look this way, and it's not. It sounds like Rice Krispies in there, but I can move it, and then there's no pain. So, yeah, it's kind of nice to not feel that burning nerve pain anymore. Now I have another one that has to be fixed, and now that one wants to kick up, but it's nothing like I was going through for 14 years. But yes, but I have been off. I work from home, except on what is it? Thursday, Wednesdays and Thursdays. I usually go in Wednesday and come home Thursday, but I found out this last week that I am too old for that. Can't do it. My mind thinks I'm still young. My body says I'm not. And it's let me know I'm not because my ankles were literally this big when I got home. So I'm
Yeah,
not going to do that anymore. So I actually have somebody coming in tomorrow. I scheduled an extra staff member tomorrow. So when I go in, they're going to help me with med boxes so I can come home. That's
yeah,
going to feel really weird because I don't let that control go of the med boxes because I am solely responsible for that. So yeah, it's going to be weird having someone else there with me doing that, but I don't know if it's going to make me more nervous or not. We'll see. I appreciate the help that they're going to give me, but I have to watch everything so close because it ultimately comes down to me. Let's
yep,
see. Oh, you're fine, Tammy, but we're here. You know that. Tammy, if you need us, we're here. Journey, let's see. My husband and I have been through so much together. He was not kind for the longest time, and I rebelled. We've learned over time on how to set boundaries and respect them. Absolutely. Yeah, Dawn. Yeah. How are you? Thank you, babe. So, yeah, do y'all have any questions in the chat? Anything to say?
I can answer questions too if anybody wants to ask me anything because I
Yeah,
don't
and
know.
and Miss Sunrise Dawn's up here. We are here to answer questions.
Yes, I am the crazy cat lady. Yeah, I haven't seen this cat all day. I even asked my husband earlier if he'd seen him because he's real sneaky, and I thought he maybe gotten out. Of course, now when I get on a live, he's gonna be all over me, and
That's okay.
this is Gray.
Oh my gosh, look.
I saw
Oh,
your
how
mama
pretty.
earlier.
How pretty.
Oh, thank you. My mom. My mom has. She takes care of his mom. His mom is a feral. Uh, one of my mom's ferals that she takes care of. And I just saw your mama today.
Let's see. Marie says, Kayla, that's a good thing. So there was someone else in charge while you were in the hospital. I've only worked, there was someone that I trained for the last 4 years. And let me just tell you, I'm going to put somebody else's comments right up under there. And that's the reason that that person is no longer employed. Like I said, I have a hard time letting go. Trust is earned and valued because it's a challenge. And you're so right on that. That is, I'm not going to talk down or about anyone. I'm just going to say that's why I go in. In fact, I was still in my neck brace when my mother was driving me to fill the meds because it's I don't know. You never know what somebody's going to do until you give them the chance to do it, and it didn't turn out so good on my end. So I'm having a hard time accepting help about that now, and that's fresh. That's only like since March. So I know if my hands are on those medications and my hands are putting them in those boxes for the week, and somebody calls me and says, "Hey, there's a mess up." Okay, then it must have been me. So tell me what I did. I don't. I just guess it's kind of a protective thing, also for the employees.
My
So
husband, my husband takes a lot of medicine. Like he takes, I think somewhere around 30
Brian,
pills a day.
what am I missing?
You
I can't
okay?
even see. Brian, are you leaving? Oh, you're gonna go take a nap. Okay. Take care, Brian. Thank you for being here. I
Bye,
missed that.
Brian. I was gonna, no, my husband takes about 30 pills a day, something like that. And
Journey says,
I, I was- I'm sorry, sorry.
that's
How's
for
he
you.
doing? He's actually doing better. We went back to this foot doctor today. He had a I mean, horribly cracked heel. It was awful looking, and they put him in bandages for a week, and they look better. It's not anywhere near healed, but the doctor is really pleased with
You
how
still here,
it
Brian?
looks. But I won't even do his medicine. He does his own. I don't feel comfortable going in there and doing his medicine. And he asked me one time, he said, "Why don't you want do that medicine?" Because I said, "Because if I mix up the wrong pills or something," I said, "I don't want to be responsible for that." Now, when he came out of the hospital, I had to learn, to at least know which ones he had to have. He didn't always get all his supplements, but the ones he had to have, I knew how to do it. But that's like, I'm not, that's not something I'm comfortable with. You know, so we've talked about getting home health to come in and do his
That
medicine or something, but
No, and that's a good idea. We all of ours before they came there to us, they mostly had, especially if it was hospice, like, and they got moved over to our facility, on hospice already, or so they would have, and even my grandfather when he was on hospice before he passed away, they they would come in because we weren't there. It was my aunt and my uncle were there, and hospice would come in, fill his pills for the week, and and because he was still at home. Um, Now I feel everybody's so that it takes hours because
yeah,
especially when you go in and the doctor's been there, the nurse practitioner's been so many changes done, and it's like, oh my God. So like I thought I was going to be really smart and fill 2 weeks worth at one time. So that way when I come in the next week, all I had to do was take and switch out the little pill packs.
yeah,
No, doctor changed all kind of medications. And I was just like, oh God. That was all a waste of time.
yeah.
So no, I'm
Well,
not gonna get the record for overachiever this week.
well, the problem is I have like an extreme phobia of allowing anybody in my house or in my house. It I think it has to do with years ago somebody called when my oldest was little. Somebody had called CPS on us.
Oh my
Well,
God.
it's DFAX here, but it was obviously somebody I allowed in my house, and I don't know exactly who it was, but we think we narrowed it down to two people. But yeah, I'm pretty sure it was somebody that got mad at my ex-husband or something. And anyway, they called defects on us, and and she was taken for a few months because that was back when you know we were doing illegal stuff that we shouldn't have been doing.
Well, I
Or
mean,
he
everybody,
wasn't. Well, he was anyway.
yeah.
So, yeah, but now it's just made it to where it's hard, even though there's nothing illegal going on. Everything's perfectly legal, and like there's no would be there wouldn't be a reason to do anything, but it's made it where it's hard for me to trust anybody coming in the house.
And I can understand that.
Yeah, it,
Yeah.
it I don't think my husband fully understands it, he's like, I don't, because I kind of panic when there's like people, people delivery people come knocking on the door, and he's like, I don't understand that. It's like I don't know how to explain it to you.
Well, it's like it's probably I mean, like anxiety driven that you don't want that to
Mm,
happen.
right, and it's also I think it's a PTSI thing.
Yeah.
That's not PTSD, but I think it, you know,
I call it PTSD too because I have CPTSD and that's the way my therapist calls it, so I just go with it.
that's what I called it for years. So
Yeah. Um, so I have a little similar story real quick. Um, is it bad when you don't want to call an ambulance for one of your residents or your patients that need to go to the hospital? Is it bad when they don't want you to call? Yeah, I would say so. Because every single time one of mine go, I get an APS case on me. I guess it's just a battle we're having right now. Oh,
yeah,
really? Hope
seeing
between
that,
dreams? I did not know that. Yep. So like, and I mean, being in business for over 20 years, they would get mad at me and call APS Adult Protective Services when a cup of theirs broke and I broke it on accident. I had the APS caseworker, she called me, she said, Keilah, yeah, I'm not. I have mine is CPTSD. That's just I'm not used to this new stuff now. Whatever. It's just it's a disorder.
PTSD.
Uh,
I said
but
PTSI, but I was trying to fix it.
no, I mean, but that's what they're calling it now. But not in my. I mean, not. I've not. I guess it's just something that's now coming to the forefront. I don't know.
Yeah.
Um, but so she said, take my number. Oh, wow, I got bullies, Tammy. I have 2 American bullies, 3. One's at work though. Um, so, um, she said, "Take my number, take APS number down off." I said, "It's our regulations. We have to have it posted for them to call you whenever they want." She said, "No, you don't. We're your governing body because we've got some legislation passed here in Texas. But
Yeah.
I said, take my number down. She said, because I don't have enough time to answer the phone calls that they call griping about. She said, if it's something serious, they will find a way to call me. I said, okay. She's like, they're
Yeah.
calling me because they can't find their coffee cup. So, well, I mean, we're following the regulations. She's like, I'm not opening the case for a damn coffee cup. So we did as we were told. And then let's see. So in 20 years, it was April 4th, 040404 is when we opened. So from there to now, I've had 121 claim case accusations, whatever, open cases on me, and 0 found it.
Wow.
So I think I hold the record, maybe
Yeah.
0 found it. But I mean, it's going to come back to me being the CEO. I mean, if they get
Yeah.
mad, they take it out on me. It's okay. I don't. A lot of those reports, so I reported myself too. I self-report. If something happens and I think I've done anything that needs to be reported, not only is the paperwork done and all the reports written and all the incident reports written, I'm going to call APS and I'm going to report myself that this will happen. And and they're like, you need to stop reporting yourself because it's not a reportable thing. I'm like, oh, yeah. I mean, this happened. So
Right.
it's like they're like, okay, y'all gotta stop. But I think, and then my phone ID today come up. It said APS and then the person's name. I'm like, oh well, can we make 122 today? But it wasn't. They were looking for placement but I just didn't have a bed available.
Yeah. Yeah. My
Oh,
my
electrolyte.
husband is my husband is, let's see, he's got bipolar, he's OCD, he's just got all kinds of, he's got several mental things going on.
Hmm.
Yeah, and I'm my thing, and now I'm noticing if I think he's triggered on something, if I think he's gonna start yelling, that's another thing that kind of sets off the PTSD. He can't figure. Sometimes I think he can't figure out why I tend to like I'm backing off from him. I'm just like I'm just trying to give you space. You know, I don't remember where I was going with that. I'm sorry. My mind
Honey, I
just
feel the
went
same
blank.
way. No, I mean, but that will set off like I know that if I'm if so weather events set me off because we've lost everything so many times too quickly.
Hmm.
Weather events, yeah, I get my anxiety. I think that's the anxiety part of it. It goes right through the roof. Okay. So, um, being yelled at. Um, I think that's why I'm able to get better with this because I'm not yelled at anymore. Um, I've had a lot of breakthroughs with, with the EMDR. Although I'm not, yeah, Marie, that it because it does cause physical change in the brain. But see, here's my brain problem. My brain has a brain injury that's permanent from a car wreck, and then from a seizure, and then my brain also has seizures since I was 5 years old. So there's a lot of damage in there that the doctor said after 6 months, if there was no improvement on my EEG, then it was going to be permanent. And I think that's what I mean. We were there a long time ago. Um, so, um, but wait, Tammy says you have a 10-year-old who loves everything, and our female loves people. But okay, so the my females, I'm going to tell her this real quick. My females, I did not know when I got American Bullies that you could not have two females in the same house. I had no idea. Okay, I rescued one, and during in 2020, I rescued one during COVID, and she was full blooded with the paperwork. Didn't even know what she was. I just knew that they were going to put her to sleep, and I couldn't handle. Yeah, I've read Jamie's. I've watched all of Jamie's stuff, but I don't know because me having seizures and all that stuff, and then having the nerve damage and the surgery that I've had with my neck, I'm not the I also like Doctor and Jamie gets a lot of his stuff from Doctor Gabriel Mate. So and my therapist actually had me watch and read one of his books for my homework. Because he says everything stems, and Jamie goes off of him too. Yeah, we've talked a lot about that. But because it's I mean you're yeah the fight or flight. But anyway, back to my bully. So I went and bought. Okay, so Oakley, and she knows when I'm going to have a seizure. I rescued her, and it's so funny. She knows when I'm going to have a seizure. I don't, but she does. And I woke up plenty of times. But no, I totally agree with Jamie on that, Marie. I promise you, I'm with Jamie on anything that will help improve anybody's life. I'm with it. I'm for it. Um, but so Oakley used to come to work with me every day, every day, every day. Till the reason she was going to be euthanized is because she killed the neighbor's cat. Well, she killed the neighbor's cat at work, or a stray cat in the neighbor's yard. And I'm like, okay, well, you can't come back to work with me anymore. And she just went mean after that. But she had one litter of puppies, and then after they were gone, um, I got her fixed because she literally I bought Luna. I went and bought Luna because I wanted her. And she she's a pocket bully. They're all gray and they're beautiful, or blue, whatever you want to call them. And they're beautiful, but she's a little bit pocket bully. Well, she had one litter of puppies and she went blind. And Oakley tried to kill her twice and almost succeeded. Like there was blood. My house looked like a crime scene. There was blood everywhere. I ended up having a seizure in the middle of all that. Don't even. I mean, when I did wake up, all I remember saying is my dog dead. I didn't know.
Yeah.
So Luna now lives at my office, which she's so happy because everybody's there with her, and I'm not her human anymore. I understand this, and I cry about it all the time. But I have a dog cam, and I look in on her every day when I'm not there. But my mail has no issues. My mail is the most freaking my male bully, he's the most calm, cool, and collected male. I mean, like he's like so cool and chilled and thinks he's Big Daddy. But um, yeah, they said you cannot have. I started calling about it. You cannot have two female bullies living in the same house. They will eventually kill each other. Male bullies, they make a lot of noise. They'll fight to, like dominant, to
dominant.
the alpha thing, the pack mentality. But females will fight to the death. And Oakley is smart in there. She's like a velociraptor. She waits her time. She bides her time. And she waits just for the right time to move. So they're extremely smart, but they're great nanny dogs, and that's what they were bred for. And they love kids.
Yeah, I had a dog that passed away last August. He was about 13, but he was a pound puppy rescue, but he was Rottweiler, Husky, and Shepherd. And most people, I would tell them what kind of dog I had, and they'd be like, "Oh, if he's got a Rottweiler in him, we don't want." Some people, a lot of people were like, I'm I'm afraid of Rottweilers. It's like you have to meet mine before you can say that again.
I
Like
had a
my,
Rottweiler.
I mean, like my parents' neighbor. I stayed with them. I stayed with my parents for a little bit after I got divorced,
Mhm.
and I had him in the backyard, and I was just telling the neighbor, I said, I said, if you see a Rottweiler mix running around, I said he's got one blue eye and one brown eye. I said, if you see him running, I said, please let me know because I said he's mine and he's an escape artist. And he's like, I don't. He said, I'm afraid of Rottweilers. I don't think I want to. I wouldn't want anything to do with Rottweiler. And this is from a guy that's got a German Shepherd. Anyway, he I was like, you got to meet mine first. And I went and got him, brought him out on the leash. Comet ran towards him like that was his long lost best friend. Started giving him kisses and getting him to play with him and everything else. I said, you still scared of him? He said, no way.
Hey, Gretchen. Snuck in while I'm over here screen sharing. I know. I
Hey,
love. Oh,
Gretchen.
I. So, Marie, I've got this. I was going to put it up for you. If y'all can see, let's see. I probably can't zoom in anymore, and I'm blind. So, but that's Jamie's book on the when they started calling it the PTSI. But yes, Jamie, I have listened to his stuff. He's like so smart. And I have listened to him for so long, but he also follows the same doctors and stuff that I do. Um and it can be seen on a scan. It absolutely can. It's just some of the things that they see on the scan for mine or from seizures or whatever. It's hey Judy.
Hey, Judy.
I'm Judy. I have a Shih Tzu that has bit 3 people. He's a jerk. I'm
This
cute.
is Bella, y'all.
I got 3 boys and mine kills cats.
This is Bella. Apparently, she's been come to say hi.
Oh, it's so sweet.
She's
So,
we
Gretchen, what do
have
you
the.
think of? Oh, go
Go
ahead.
ahead,
I'm
I'm
sorry,
sorry.
John.
I
No,
was
go
just gonna
ahead.
say we have the one dog out of all of them. We have 14 cats and one dog. And trust me, Jasper knows who runs the show, and it is not him. These cats let him know real fast. We are in charge.
Um, yeah, my last cat, I had him 19 human years. I just can't. I
Oh,
mean, plus Oakley would, you know. Hi, Judy. So to see where. Hey, you're welcome to come up. Gretchen, are you still here? I had a
and I,
question for you. Let's see if Gretchen's still on here. Sure she is. And I have a lag on my StreamYard side, so I don't know what's going on.
yeah, I had a husky that we didn't mean to have puppies. We had two rescues that we didn't spay and neuter fast enough, and we ended up with puppies. So we kept one, and she lived till she lived to be 11. She was 4 days shy of being 11. So I told my husband she was my girl. She was my best friend. I said I held her the
Yeah.
day she was born, and she when we had to put her down because of cancer, and I said I held her in my arms while she died. So
Mm,
she was my baby, and I
I
was telling
couldn't.
my
My
husband,
sister's. Mm.
I was just because I was telling my husband, I said she's the only one that I've gotten to do that with, that I've gotten to raise. She's the only animal I've ever raised
From yeah,
from birth onwards.
it's hard. It's hard. It's really hard. Okay, Gretchen.
Trying
Let's see. Wait, Gretchen, hang on just a second. I wanted to tell Tammy. Yes, my female now. Okay, so Luna at work is she's blind. She can see a little bit far off, but as far as anything up close, she can't. I mean, she ran smack into a freaking privacy fence. Okay. I mean, I feel so bad too, and I started crying. Um, okay, Tammy, we have a good night.
Good
But
night,
yes,
Tammy.
my female's got that prey drive too, and I don't know why, but my males don't. It's weird. I never knew that. So I'm glad I'm not the only one that is going through that with bullies. That's I I, I didn't know. But, Gretchen, okay, I'm sorry. So on CPTSD, the we were talking, Marie, we were talking about, like they now they're calling it PTSI, but so is there a, and I'm going to ask you this because I have no idea without having to look it up. Um, is there a difference? I mean, is it called CPTSI? So like, because you have these extra things for the, the C part of it. I understand the PTSI, but is there a difference in calling it CPTSI or CPTSD? Because sometimes I don't think that mine's ever going to be gone until I started reading on the art that accelerated. And I actually told my therapist that I wanted to try that. I've tried every other thing. I want to try that. And so she already tries that. She hasn't tried it with me. So in 2 weeks, we're going to start that because it's
Good.
supposed to be faster results than the EMDR because it takes forever.
Yeah.
Sometimes I don't want to do it anymore. But I mean, I give 100% in therapy because I wanted the 100% out of it.
Yeah. Well,
I'm
she's.
just, yeah, it's StreamYard's got such a lag. It takes a minute.
I was just gonna say while she's answering, I was just gonna say, when after I told my husband that with the dog, I said with my dog, I said that's the only animal I've ever gotten to raise from from birth from birth to death. And I said
Yeah.
it was just a few months later we wound up taking in a stray that my mom had, her and her brother, which you've seen her brother. He was up here gray, and we
Mm.
brought him and his sister was already pregnant, and so I now have four cats that I'm raising from birth to death. I told my husband, I said, I really think, and it probably sounds crazy, but I said, I think Smokey has something to do with that. Maybe, for wherever she's at, she said, I think mom needs another one, needs more to do that with, and sent me the whole litter.
Okay, let me get it here. Okay, so okay, Gretchen, I got that. Sophia, yeah, you're probably right. Judy, I liked it, yeah, because it's not in the DSM. That's why, but a lot of things aren't. Um, but Judy, I like the EMDR. I just actually cleared a lot of things out with the EMDR, a lot of things out. But it is taking so long to get through. So because let's face it, I'm a mess. I'm a dumpster fire, and that trauma from being a child, we haven't even gotten to that point yet. But EMDR, it worked well. It has cleared a lot of things out and turned a lot of things in. Hope between the dreams you live. Oh, okay, I got you. Have a good
I was gonna,
night.
I was
Yeah,
gonna
I'm
say,
not
I
going to be
need,
on here. You got to go, Dawn,
I,
too. Okay, well, you have a good night. We're not
I,
going to be on here much longer, guys, because I'm going to go watch the lunar eclipse here in just a minute. But I
I know,
wanted
I
to
was
look
just
up
gonna
some.
say, I need sleep chocolate.
I know, sweet chocolate. I love how she put that.
I need sleep
Dawn, you have a
chocolate.
good evening. Emotion regulation. That's half of it, the battle. No, between trains, who I can't believe how tired that made me. Dawn, EMDR, what are the complexity or not, it's still a physical injury. Yeah. EMDR saved my life 2 years ago. EMDR has done wonders for me. It's just taken so long. Judy, really sounds. I've been in therapy for a few years now, but I compartmentalized everything, and one day they just all burst open. And that's what I say. That's the bad thing about not addressing the things when they happen. EMDR helped me. I'm not bashing EMDR, please. That helped me tremendously. But I want to try this new thing. And I didn't know about what it was. And let's see. Yeah, here we go. Let's see. That's exact. I want this accelerated resolution therapy. I know I need to finish. I mean, I cleared a lot of bad stuff out and figured out a lot of stuff and replaced a lot of those trauma memories and trauma circuits that were in there with positive. Love you, hope between the dreams.
I hope.
It's not that I don't want to do it again. I will, because it helped me. I mean, it did. It's just some of the things that I've got. Not really. I mean, meditation, breathing, mindfulness, scratching. I have to do that every day, all day. My anxiety is through the roof, and I don't know why. That's another thing, and that emotional regulation is really, really needs to be. I mean, I'm aware I have insight that it's happening, and I will if I cannot do that myself, I will call like Kathy. She's my first one. I'll call, and she'll say 5, 4, 3, 2, 1. I mean, like I just have to hear her guiding me through it. Sometimes, like I said, if I'm alone in the grocery store, no. I mean, I went down the baby aisle and just sat there, and I was like, I did the 3-3-3, just looking around, just to get my mind off of it. I've never been like that in all my life, and I don't know why now. It's like, wow, everything's just everywhere. It's just it's a mess up here. But being an empath doesn't help, because sometimes I don't know what my mess is and what's not. And I think that's a lot to do with my anxiety also. Where is this at? Here we go.
Can y'all hear me okay? I'm just having trouble with my earbuds.
I can.
Okay, I just want to make sure I had to take them out.
So, okay, so Aria, look here, and Judy, look, this is what I liked about the accelerated resolution therapy. Now, I don't know if it works. All I've heard about is good stuff, but it's accelerated resolution. It's psychotherapy, which roots in existing evidence-based therapies, but it's shown to achieve benefits much more rapidly. I know that they said it like some people in one session. I hope, really. Yep, the world is a mess. That's why. Empaths seem to be drawn here. I promise you, you're not alone in here. It is a curse and a blessing sometimes. So this is.
I want to look
They're
into
saying
those
this.
DS. Sorry,
Huh?
honey.
No, go ahead.
Sorry, I was just gonna say I really want to look into the DSR shots for my husband. I think they would really help him.
And I see, like, okay, on the accelerated resolution therapy, the art, and it, it's for PTSD. But if you're finding it difficult to move past the trauma, oh, you don't have to be quiet. Yes, it is a blessing and a curse, and that's the truth. Hope. I mean, it really is. There's not anything we can do about it except go with the gifts that we're being given. Oh, it's okay, Judy. Welcome, and please come back. Please come back. Because we're going to be on again. It won't be tomorrow, but it'll probably be Thursday, and hopefully Gretchen will be able to be on. I know she had a lot to do today, but I won't be able to be on tomorrow, so I wanted to get on here and just say hi. I haven't been able to play music lately from my injuries, and I think that took a toll on me. Music was my escape too, Aria. I've talked to you about that. That's look, that's my therapy. I have the semicolon project and my music note. That semicolon project is like that's, I want everybody to remain. um, but it says, let's see on here. If you're finding it difficult to move past the trauma, accelerated resolution therapy may help. The therapeutic method, can I read tonight? The therapeutic methods involve eye movement and visualization. But what it does is it uses eye movements aimed to quickly alleviate symptoms which are often related to past trauma, but you don't have to go back to that past trauma to remember it and to remember it again. It replaces it with another. I read it, and I'm probably not going to say the right thing, so let me look. The goal of this therapy is to help people find relief from past trauma through the use of eye movement. It's almost like EMDR. But it also draws from CBT, the cognitive behavioral therapy, and psychodynamic approaches. And they say that according to its creator, that it is more directive, easier to learn, and often administered in a shorter time than EMDR. And it's a guided session, and you visualize the event that caused you the distress, but you don't have to acknowledge it and speak it and all that. And it says, and it's a guided, it's guided just like EMDR. And it says you will visualize either an event that causes you distress or a metaphor for that event. So the therapist then moves their hand from side to side while you think of or describe the traumatic event, and you follow their hand with your eyes. Narration is not required, so you don't have to talk about it if you don't want to. And then the bilateral eye movements, we all know that's with the EMDR. And it says it helps to move traumatic memories into long-term memory. And then you imagine what you wish would have happened in that traumatic situation rather than what actually happened. As the therapist continues to move their hand back and forth, imagery that invokes negative emotion may be replaced by visualizations that inspire positive emotion. And then the benefits are you don't have to visualize distressing images related to the trauma. The treatment is generally brief, and most people find relief quickly. Let's see, what did Gretchen say? The doctor, let's see. Research shows, for example, that adults with PTSD have a reduction in an area of their prefrontal cortex and a reduction in the volume of the hippocampus. Yes, the hippocampus. Yes, absolutely. Yes. That is a major one, and you can actually connect that to Scientology, the hippocampus. I just helped a friend of mine finish doing some research, and that is the big thing. Hope, let's see, I worked with some amazing artists, Jack Johnson. It was the first, and Dave Matthews and Pink. Oh my gosh. Okay, in the absence of these regulatory mechanisms, adults with PTSD may feel overwhelmed with stress and anxiety, even in the absence of any real danger. Overwhelmed for me, I don't know. I don't know how to say it. It's kind of hard to explain it. I don't know if I feel overwhelmed or maybe that is the word. I know that when I have those come on, I don't know, it happens, and it's just like, I can't move. And I have insight that I need to correct this, but sometimes it's difficult to do that. Yeah. And I need somebody to guide me. So I have my people that I can, like Kathy Ann, I call her. All I have to do is just help, and she knows what to tell me. I have people that will work with me and help me, walk me through that, even if I'm here all alone. And that's huge. The support is huge. But yeah, that art seems to be something that um, you don't have to make a written or verbal description of the traumatic experience, and that's what I liked. You don't have to go back and describe everything that ever happened. I don't know if it works. It says it relieves symptoms including anxiety and emotional and physical reactions from the reminders of the trauma. So I really hope it's a real thing. I really hope it works. I want to try it. Anxiety attacks are complex stressors till one makes it too much. Yes, actually, absolutely. Sounds like a hot flash of emotions. It just comes when it goes. It does.
Hmm.
Aria, good night, sweetheart. I know you're
Good night,
exhausted. And
Arya.
oh, Gretchen, guess what? Aria finally gave me the permission. I got to say it. She's 14 weeks with twins.
Congratulations, Arya. Uh, Lyric will make a great big brother.
Mm-hmm. Lyric definitely will. Yes, how
Yep.
panic attacks feel? Absolutely. And see, I didn't know if I never knew what a panic attack was. Like, I didn't know. I don't know. I didn't know for myself.
I had
I
panic
know, right?
attacks.
They're fraternal. She finds out the sex on the 14th. I done did all the investigating on Ari.
I've had,
Oh, Gretchen already knew. Ari, I see. Well, at least we got to
yeah,
tell everybody on here.
I had
Did she
panic
give
attacks
you?
for a long time before I knew what they were. You know, I, di-
I was
I
always
didn't
this
know
outgoing
exactly what to
person,
call
and
them.
then
I
all
didn't
of
know
a
what was
sudden,
going on.
I was always this outgoing person. I wasn't scared of. Oh, you're planning on babysitting? She got interrogated by me, though. I have to say that. Oh, I love you, Aria, and you have a good night, baby. Go get you some rest. We're fixing to be done here. But no, panic attacks. I did not know what. I never felt that. Okay, so
Right.
that's okay. Sophia, panic attacks are commonly more sudden without the buildup. Yeah, the anxiety attacks, that I know because exactly what you said. Anxiety attacks are a complication of stressors until just one just makes it too much. And then yes, I'm breaking all the news. Right? Journey and Aria and boy, I love this channel and I love this community.
I went through a robbery at my work back in
Is that
'09, December
mm,
of '09. And, it took a lot of years before I could even think about seeing somebody with their face covered. Like, especially, with it being winter, I mean, there were people walking around that would have their scarves wrapped around their face because it was so cold outside, and I couldn't handle it. I would have to leave, you know, I'd be out there hiding in the van for a while. And I mean, I've been on anxiety meds for a while, not just because of that. But that was one of the main things. And even now, every once in a while, if I see somebody, now for some reason, a full mask doesn't bother me. It's never bothered me. But if I see somebody with their face half covered, I can't. I have to walk away
oh god, I
sometimes.
bet this lockdown was hard. The pandemic was horrible for you.
It was in a
I gotta
way
eat
it
a
was, in a
mask.
way it made, but in a way it helped because I had to force myself to face it. You know,
Yeah.
no pun intended.
No, I I got you. Hope. Let's see what Hope said. You started therapy for the first time at age 4. Hang on. Um, okay, Kathy, thank you. Please come back. Please come back. I mean, thank you for being here. Um, and have a safe and a great night. Y'all don't forget to look up at the moon and actually
Good
the
night,
event was going to
Kathy.
be like an hour and 4 minutes. I need to look at something because I know that. Oh, I didn't know before Grace. I just got to tell everybody I'm just happy about that. So, oh gosh, she let 2 of the bullies out, the brother and the sister. Oh, uh, hang on. This is works. I apologize.
That's okay.
Okay,
It's all
I
right.
had my ringer off. I should not have probably done. So, what I was looking at is going to. Let's see. I already asked this once. Okay, so it's going to be. Don't tell me you changed it already. Okay, so it's saying 10:44 p.m. but Eastern, but it's 9:44 for me. It will be visible across most of the United States, Canada, Latin America, the Caribbean, Africa, and Europe. And it's the eclipse will happen between 8:41 p.m. Eastern, which is 7. Whoa. And okay, so it's saying so my time it'll be 7:41 to 11:47 with maximum partial phase occurring at 9:44 Central Time. So yeah, I'm gonna go out there and film it. Let's see. I was on Topamax for my seizures, and it did not work. I kept having way too many breakthroughs, and then when they upped the dosage, I actually started having nightmares and restless leg syndrome, and I don't know where that. My doctor calls me her unicorn. She's like everything that's supposed to work on you does, and everything that's not supposed to work on you does. So yeah, she's like I'm her case study. But so, it's weird. But so Topamax did not help it didn't hold them, it didn't work. But now that I'm on Lamictal, it helps. We've had to, titrate the dosage up, but I've been on it now for a while. And I yes, the Topamax, I kept having breakthroughs and it was too much, too many. I am not having anything put in my brain ever. Nope, can't do it. Won't do it. Mandy, I'm trying to figure out where my bipolar actually lies because the criteria has changed since I was diagnosed. Gretchen, she's in here. Yeah, but Mandy, I mean, it's up to you. You don't have to answer this. This is a personal question, but I mean, you're not a cluster B though, correct? Wait. Alicia, thank you for coming on here with me tonight.
Oh, you're welcome. It's
Okay, yeah, I
my
didn't think you
eyes.
were. Mandy's not a cluster B. No, no, I don't think so either. But I'm not a doctor. I just ask. There's a no. Uh,
Um, my husband, I think we're gonna have to get some of his medicines adjusted because he's getting to where they're not lasting as long as they should, like in between from night to day. I mean, morning to night. I don't know. He turns into a different person when those medicines wear off, and they shouldn't be wearing off as fast as they are.
um,
And he becomes somebody I don't know.
yeah, there, yeah. Gretchen and Mandy talk because yeah, I didn't think you were a cluster B, Mandy. I'm at all. But I was just wondering. Um,
One thing I need to look into is early intervention for kids with mental illnesses and stuff because with my daughter, she has so many of my husband's traits that it's unreal, including like his bipolar and stuff. We see it in her. She can be fine and happy one minute and just, all perky, and the next thing you know, she's screaming because she's so mad. And she will start, she'll start swinging. She'll hit, whatever's around her or near,
mhm.
and then she's right back to being. Within a few minutes, she's usually right back to being her happy-go-lucky self. And we've noticed she does the OCD things. She has to have things a certain way, or it really bothers
Mhm.
her. And at first, I thought it was just her copying him, but then I realized a lot of her little rituals that she has are different from his. You know, like
She's
she
not.
has to have.
She's so young.
She is, and I really like to get it caught. If that is the case, I want to catch it early so that she doesn't. Hopefully, she doesn't have to go through everything we went through.
Thank you,
But,
Gretchen. Love you. Thank you, Gretchen. I appreciate it.
yeah, she has to have there for the longest time, and I think she's gotten a little better about it now. But she had to have things in the number threes.
Threes, yeah.
Everything had to be in threes.
Mine in there. She's got it's fives.
Yeah, and so that's what. that's one thing I realized she wasn't copying my husband, because with him it's everything's in fives. You
Mm-hmm.
know.
Hers is 2, hers is 5s. Yeah, Sophia said channel her energy into high focus activities. Yes, because I have my own personal opinion and I will keep it to myself because I'm not going to make anybody upset, that I get really weirded out when children are still growing, their brains are still forming. They still can be, I mean, if you have a chemical imbalance, you have a chemical imbalance. There's nothing you can do about it. That is not
Right.
your fault. But if it is just like a behavioral issue that needs to be channeled energy here, there, whatever, yeah, I, I would, of course, obviously, I would rather go that route. But I
Yeah.
mean, it's to each person, they have to do what's best for them, and they know their child the best. Because I was so against
Right.
my niece being put on anything for ADHD, being such a young one. That's first thing the schools do, put them on medicine. But when it started affecting her grades, I said, put her on medicine, and
Yeah.
she got on it. Tampa Bay man, I love you.
See, my oldest was ADHD.
And I am
And
too, and now I'm unmedicated. So,
yeah, I fought
oh,
putting her on
Mandy,
medicine.
wait, look,
Yeah.
Mandy said, if your kid is ADHD, sports or martial arts.
Yeah.
I love you,
Well, yeah.
Barbara.
I
Mhm.
fought putting my oldest on medicine for a while, because I didn't like the ideas, side effects and things like that. But they ended up putting her on Vyvanse, and
That's
it
what I
helped.
was on. That's what I've been on for God, I don't know how many years, like years. In fact, the first 8 years and they were supposed to not get yeah, none of the non-stimulants worked on me, but as an adult
Yeah.
getting on it, yeah, not as a child. I never took any medicine as a child, but as an adult, um being diagnosed with it, um they started on we started on all the non-stimulants, and then it didn't work. So and then I could not do the Adderall and all that crap. I shook too bad. And then
Yeah.
so here comes this brand. Oh no, Mandy. I will never. I mean, that's one that my family's had a very bad tragedy because of that. I love you too, Barbara. Um Ritalin is just I'm you know, I don't know. My family had a bad
Hey,
tragedy
Barbara.
because of that drug. But I'm going to tell you this, that when we started me on 30 milligrams of Vyvanse, and it worked, but I didn't say that focus, but it worked. And see, I only have one kidney, and I only have a liver that functions like a quarter of the speed as everybody else's, because they've put all my medicine to go through my liver instead of my one kidney. So it's a balance there. Do you want to kill your liver? Or do you want to kill your kidney? Blah 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 blah. Anyway, your liver will repair itself. Your kidney won't. So that's the way we've always went. And it just was so hard. But we got me up to 70 milligrams on the Vyvanse. That's where I've been. I know, I know, I know. Have no leukocytes, so I catch everything ever sick. Mandy said, "Oh my God, you need to be in a bubble." I'm bubble boy, bubble girl. Um, but so Vyvanse worked until it didn't work on my heart anymore. Then when I got out of this last surgery and started having heart issues, and they said I was in heart failure, and I was scared. I was like, "What did that doctor do to me while I was under?" That's the first thing I thought, because I didn't have that problem before I went in, and now I can't take. I mean, my doctors didn't take me off the Vyvanse. I took myself off. Well, actually, the
Mm.
pharmacy did when they ran out of stock for 2 months. Didn't
Yeah.
really have a choice. But you're right. My heart rate was staying at 160 resting heart rate for months, and I said, "Oh, I'm going to die like this, literally." I mean, so so they got me on, and my legs were they were so big, my ankles. Um, so they skipped the Lasix, the furosemide went on torosumide, and which is hard on the kidney, but I mean, I have to have it or I can't walk. Or like when I had pneumonia this last week, it all the fluid backed up into my lungs, and um, so uh, so I took myself off the Vyvanse since the pharmacy ran out of stock and half the United States didn't have medicine. And that was right when school started back. They said that there was going to be a shortage. and I went ahead and I didn't want my heart rate anything else that would make my heart rate go up because it just would not come down. And I mean, I literally my resting heart rate at 160. I mean, I was getting alerts on my watch every 5 seconds. Like it wouldn't quit. I had to
Yeah.
move my 120 heart rate up to 180 before to stop it the alert from going off. So with the fluid pills, they doubled my metoprolol. Oh, my credit card machine's batching. They doubled the metoprolol. They let's see, and then I took myself off the Vyvanse. And then she started me on a bunch of vitamin D. I've got to figure out what that was all about. And then aspirin a day, and then my Synthroid because my thyroid was messed up. They okay, come back out messed up. With all of that straightened out and all these meds I'm on now, and I'm not putting myself back on the ADHD medicine if I can control it without it, and I'm learning how to do that. I feel better, and my heart rate
Yeah.
is like in the 80s. It's in the 80s, and my blood pressure is not 191 over 102 anymore. Now my blood pressure is more along the lines of like 120 over 70. So whatever we're doing it right. So I'm going positive in the right direction.
My oldest, she decided to take herself off of Vyvanse once she graduated high school, which is, it's her decision. If she's 18, she could take herself off if she wanted to. She just, but we do kind of we kind of joke around because even with her ADHD, caffeine will actually calm her down.
Me too.
Yeah.
I
And like,
drink coffee before I go to bed. I can drink tea before I go to bed.
yep,
If it's caffeine, it slows you down. Yeah.
yep. And that's it. People want to give her a hard time, like the guy that she's dating now. Of course, now he knows. They've been together about 3.5, 4 years. But he would, you know, sh- he would always. I think it confused him because she'd be, all wired up, and she'd go to drink a coffee or something to kind of settle herself down. He's like, I don't understand. I'm like, well, just wait till you've been around her a while, you'll see. Yeah.
That's what my mom said. You start 50 projects, Keilah, you never finish one. But I mean, I would rather live like that than not be able to be living it all with no heart. My heart will exploding. So, all right, guys. Well,
Well,
I'm going to go outside and I'm going to watch the lunar eclipse. And I just realized I'm not going to be able to go live on TikTok because, yeah, Sophia, right. Yeah, caffeine before bed. It's so funny. Everybody tells me because, okay, people with ADHD, we function better at night. We get more done at night. We're more alert at night. I don't know why that is. I've
mhm.
seen too many studies about it. It is the truth. I'm more productive and more creative at night than during the day. It's hard for me to get motivated to get going. Once I get going, I'm good. But
I'm
they
the
were like,
same
"Well,
way.
you need to sleep. You need to, don't drink caffeine." I'm like, "You're talking to somebody with ADHD, and you're telling me don't drink caffeine when that is exactly what it does. It puts me to sleep. It slows
Hmm.
everything down. I'm totally opposite of what. Oh, some people can't make them understand. But
This
everybody,
okay.
I'm gonna go look at the moon. And I've just thought about I'm not gonna be able to go live on TikTok and show it happening because I don't have my telescope set up, but my telescope is not even as good as my phone, my Android, my Samsung Galaxy. Oh, that baby! Look at that. Oh, my
This is
baby.
Sabrina. I call her my
Hey,
Velcro cat.
Sabrina.
I call her my Velcro
ADD.
cat.
Yeah, Marie.
When I got her, she didn't want anybody to touch her. She wanted to be left alone. She just, would keep her distance, stay away from everybody. And I just worked with her for a few weeks, and here she is.
You're just so
She's stuck
pretty.
to me all the time.
Okay. Oh, I love you, babies. Oh, how sweet. So, and when I figured out my phone, my Android actually got the video that it's got my camera that actually will zoom in 100 times. I can actually see everything on the moon. I can see satellites flying if they fly through the area between the moon and my phone
Oh
if they're
wow.
close to. Yeah, I mean, that's just my phone. I like it way better than having to set up the telescope, which doesn't have as much power. My phone has the 100 times zoom. So I'm gonna go out there and I'm going to record it, and I probably just have to upload it. But I will upload it, and I'm gonna upload it to my TikTok and to Facebook on my personal Facebook page. So I'm gonna go check it out, and maybe I can get it to go after I record it. I've got to learn that I've got all these things I'm learning to edit. So, but I'm going to try to get them like that fast forward where it just shows it going through, so it's not so long sitting there staring at it.
Yeah.
I'll figure it out. But thank y'all everybody for being here. Thank you, Mandy. Thank you. Let's see, Marie, Sophia, Hope, let's see, Barbara, Tampa, Susan. Let's see, we got. I don't know who else still in here, but I know Gretchen. I think she said she was leaving, and then, um, okay, Sophia and Aria left, and Marie. Okay, so I think we're okay. Hope, love y'all. I love y'all. I really appreciate y'all so much for your support. Thank you, Alicia, for coming on here with me.
Thank you for allowing me.
Well, I appreciate it very much. So I was gonna have to wing it tonight by myself. But no. But I will be out there if y'all want to go look at the moon. It got about 45 more minutes and it's gonna be up there. So well, for us over here anyway. But love y'all. Talk to y'all later, and thank you, Dawn. I gotta get over here to my outro, but Barbara and you too, Marie. Barbara, love you, Tampa. And I am going
Bye.
to go where I'm supposed to go and try to find it here. Okay, and here we go. And we will talk to y'all later.
Bye.